Welcome to our exploration of clinical leaders and their vital role in healthcare. Clinical leaders are the backbone of effective healthcare teams, guiding professionals through complex situations and ensuring high standards of patient care. In this video, we'll uncover what makes a clinical leader, why their role is so crucial, and how they influence both patients and staff. Whether you're a healthcare professional or simply interested in how hospitals function, understanding clinical leadership is key to appreciating the inner workings of modern medicine. Let's begin by defining what clinical leadership truly means and why it matters. Clinical leadership refers to the ability of healthcare professionals to influence and guide their teams toward achieving the best patient outcomes. Unlike traditional management, clinical leaders often work directly with patients and staff, blending clinical expertise with interpersonal skills. They set the tone for collaboration, encourage evidence-based practices, and foster an environment where everyone feels empowered to contribute. This unique blend of skills distinguishes clinical leaders from other roles within healthcare organizations, making them essential for delivering safe, effective, and compassionate care. The heart of clinical leadership are several core responsibilities. Clinical leaders are tasked with ensuring patient safety, promoting best practices, and supporting continuous improvement. They oversee the implementation of protocols, mentor junior staff, and act as role models for ethical behavior. By maintaining open communication and encouraging feedback, they help create a culture where learning and growth are prioritized. These responsibilities require a balance of clinical knowledge, emotional intelligence, and strong decision-making skills. Clinical leaders have a direct impact on patient care. Their decisions and guidance shape how care is delivered, from diagnosis to treatment and follow-up. By fostering teamwork and supporting evidence-based approaches, they help reduce errors and improve patient outcomes. Clinical leaders also advocate for patient needs, ensuring that care is personalized and respectful. Their presence reassures both patients and families, building trust and confidence in the healthcare system. Key role of clinical leaders is supporting their teams. They provide guidance during challenging cases, mediate conflicts, and ensure that everyone's voice is heard. By recognizing individual strengths and encouraging professional development, clinical leaders help team members grow in their roles. This support not only boosts morale but also leads to better collaboration and more effective patient care. In high-pressure environments, clinical leaders are the steady hand that keeps the team focused and resilient. Effective communication is a hallmark of clinical leadership. Leaders must convey complex information clearly, listen actively to concerns, and adapt their communication style to different audiences. Whether discussing treatment plans with colleagues or explaining procedures to patients, clinical leaders ensure that messages are understood and acted upon. This skill is vital for preventing misunderstandings and fostering a culture of transparency and trust within healthcare settings. Healthcare environments are often fast-paced and unpredictable. Clinical leaders must make critical decisions quickly, sometimes with limited information. Their ability to remain calm, assess situations objectively, and weigh risks is essential for patient safety. By involving the team in decision-making and considering diverse perspectives, clinical leaders ensure that choices are well-informed and balanced. This approach not only improves outcomes but also builds team confidence in challenging situations. Mentoring is a significant aspect of clinical leadership. Leaders invest time in coaching junior staff, sharing knowledge, and providing constructive feedback. This mentorship helps new team members develop confidence, refine their skills, and adapt to the demands of healthcare. By fostering a supportive learning environment, clinical leaders ensure that the next generation of professionals is well prepared to deliver high-quality care. Clinical leaders champion evidence-based practices within their teams. They stay updated on the latest research, encourage ongoing education, and ensure that protocols reflect current standards. By promoting best practices, clinical leaders help reduce variability in care and improve patient outcomes. Their commitment to continuous improvement inspires others to strive for excellence and embrace innovation in their daily work. Ethics are at the core of clinical leadership. Leaders are often faced with difficult choices that require balancing patient needs, organizational policies, and professional standards. By modeling ethical behavior and facilitating open discussions about ethical dilemmas, clinical leaders set the standard for integrity within their teams. Their guidance helps ensure that patient care is always delivered with respect, dignity, and fairness. Conflicts can arise in any healthcare setting, and clinical leaders play a key role in resolving them. By addressing issues promptly and fairly, leaders prevent small disagreements from escalating into larger problems. They use mediation skills to find common ground and encourage open dialogue among team members. This proactive approach not only maintains a positive work environment, but also ensures that patient care remains the top priority. Collaboration is essential in healthcare, and clinical leaders are the driving force behind it. They bring together professionals from different disciplines, ensuring that everyone works toward common goals. By promoting mutual respect and understanding, clinical leaders break down silos and encourage knowledge sharing. This collaborative spirit leads to more comprehensive care and better outcomes for patients. Healthcare is constantly evolving, and clinical leaders must be adaptable. Whether it's implementing new technologies, responding to policy changes, or managing unexpected crises, leaders guide their teams through transitions. Their flexibility and resilience help teams stay focused and motivated, even in uncertain times. By embracing change, clinical leaders ensure that their organizations remain at the forefront of patient care. Trust is the foundation of effective clinical leadership. Leaders earn trust by being transparent, consistent, and approachable. They follow through on commitments and admit mistakes when they occur. By building strong relationships with both staff and patients, clinical leaders create an environment where everyone feels valued and supported. This trust is essential for teamwork and high-quality patient care. Clinical leaders inspire others by leading through action. They demonstrate professionalism, dedication, and a commitment to continuous learning. By modeling the behaviors they expect from their teams, leaders set high standards and motivate others to follow suit. This approach creates a culture of excellence and accountability, where everyone strives to do their best for patients and colleagues alike. Innovation is key to advancing healthcare, and clinical leaders play a pivotal role in encouraging it. They create an environment where new ideas are welcomed and experimentation is supported. By recognizing and rewarding creativity, leaders inspire their teams to seek better solutions and improve patient care. This openness to innovation keeps healthcare organizations dynamic and responsive to changing needs. Resource management is another important responsibility for clinical leaders. They ensure that staff, equipment, and time are used efficiently to maximize patient care. By monitoring resource allocation and identifying areas for improvement, leaders help prevent waste and reduce costs. Their strategic approach ensures that teams have what they need to deliver safe and effective care, even in resource-limited settings. Patient safety is always a top priority for clinical leaders. They implement safety protocols, monitor outcomes, and respond quickly to potential risks. By fostering a culture of safety, leaders encourage staff to report concerns and participate in safety initiatives. This proactive approach helps prevent errors and ensures that patients receive the highest standard of care at all times. Clinical leaders are committed to the ongoing development of their teams. They identify training needs, support continuing education, and provide opportunities for skill building. By investing in professional growth, leaders help staff stay current with advances in healthcare and maintain high levels of competence. This focus on development benefits both individual team members and the organization as a whole. Organizational change is inevitable in healthcare, and clinical leaders are essential in guiding teams through transitions. They communicate changes clearly, address concerns, and help staff adapt to new processes. By maintaining a positive attitude and providing support, leaders minimize disruption and keep teams focused on delivering quality care. Their leadership ensures that changes are implemented smoothly and effectively. Clinical leaders are strong advocates for their patients. They ensure that patient voices are heard, preferences are respected, and care is tailored to individual needs. By championing patient rights and addressing barriers to care, leaders help create a healthcare environment that is inclusive and patient-centered. Their advocacy is a powerful force for positive change within the system. In times of crisis, clinical leaders are relied upon to provide direction and reassurance. Whether facing a public health emergency or an unexpected event within the facility, leaders coordinate responses, allocate resources, and communicate clearly with staff and patients. Their calm and decisive actions help teams navigate uncertainty and maintain high standards of care, even under pressure. Feedback is essential for growth, and clinical leaders actively seek it from their teams. They create safe spaces for honest discussions and use feedback to drive improvements. By valuing input from all team members, leaders foster a culture of openness and continuous learning. This approach not only enhances team performance but also leads to better patient outcomes. Clinical leaders often juggle both clinical and administrative responsibilities. They must balance patient care with tasks such as scheduling, budgeting, and policy development. By managing these diverse duties effectively, leaders ensure that operations run smoothly and that patient care remains the top priority. Their ability to multitask and stay organized is crucial for the success of healthcare teams. Diversity and inclusion are important values in healthcare, and clinical leaders play a key role in promoting them. They ensure that teams reflect the communities they serve and that all voices are heard. By fostering an inclusive environment, leaders help reduce disparities and improve care for all patients. Their commitment to diversity strengthens teams and enhances the quality of care. Technology is transforming healthcare, and clinical leaders are at the forefront of this change. They evaluate new tools, oversee implementation, and train staff on best practices. By leveraging technology, leaders improve efficiency, enhance communication, and support better patient outcomes. Their forward-thinking approach ensures that teams are equipped to meet the demands of modern healthcare. Performance measurement is a key function of clinical leadership. Leaders set benchmarks, monitor progress, and use data to identify areas for improvement. By regularly reviewing performance metrics, they ensure that teams are meeting goals and delivering high-quality care. This focus on measurement drives accountability and supports a culture of excellence. Healthcare can be demanding, and clinical leaders help manage workload and stress within their teams. They recognize signs of burnout, provide support, and encourage work-life balance. By addressing stress proactively, leaders help maintain team well-being and ensure that staff can continue to provide high-quality care. Their support is vital for sustaining morale and performance. Clinical leaders often engage with the wider community to promote health and well-being. They participate in outreach programs, collaborate with local organizations, and advocate for public health initiatives. By building strong community relationships, leaders help extend the impact of healthcare beyond the walls of the facility and address broader health challenges. Quality improvement is a continuous process in healthcare, and clinical leaders are its champions. They identify opportunities for improvement, lead quality initiatives, and measure results. By fostering a culture of quality, leaders ensure that teams are always striving to enhance patient care and safety. Their dedication to improvement drives progress and sets new standards for excellence. Clinical leaders play a crucial role in implementing policies and procedures. They interpret guidelines, ensure compliance, and adapt policies to fit the needs of their teams. By providing clear direction and support, leaders help staff understand and follow best practices. This ensures consistency and safety across all aspects of patient care. Teamwork is at the heart of effective healthcare, and clinical leaders are its strongest advocates. They promote collaboration, recognize achievements, and resolve conflicts quickly. By building strong, cohesive teams, leaders ensure that everyone works together toward common goals. This spirit of teamwork leads to better patient care and a more positive work environment. Compliance with regulations and standards is essential in healthcare. Clinical leaders monitor adherence to laws, accreditation requirements, and organizational policies. By staying informed and educating their teams, leaders help prevent violations and protect both patients and staff. Their vigilance ensures that care is delivered safely and ethically at all times. Research is vital for advancing healthcare, and clinical leaders support it in various ways. They encourage participation in studies, facilitate data collection, and help translate findings into practice. By fostering a research-friendly environment, leaders contribute to the ongoing improvement of patient care and the development of new treatments. Risk management is a key responsibility for clinical leaders. They identify potential hazards, implement preventive measures, and respond quickly to incidents. By maintaining a proactive approach to risk, leaders protect patients, staff, and the organization. Their diligence helps create a safe and secure healthcare environment for everyone. Interdisciplinary care is essential for addressing complex patient needs. Clinical leaders bring together professionals from various backgrounds to collaborate on care plans. By coordinating efforts and encouraging open communication, leaders ensure that patients benefit from the expertise of the entire team. This approach leads to more comprehensive and effective care. Positive workplace culture is vital for staff satisfaction and patient care. Clinical leaders set the tone by promoting respect, recognition, and a sense of belonging. They celebrate achievements, address concerns, and ensure that everyone feels valued. This positive culture boosts morale, reduces turnover, and supports high-quality care. Self-care is important for healthcare professionals, and clinical leaders encourage it within their teams. They promote healthy work habits, provide resources for stress management, and support time off when needed. By prioritizing self-care, leaders help staff maintain their well-being and continue to provide excellent patient care. Change management is a critical skill for clinical leaders. They guide teams through transitions, address resistance, and ensure that changes are implemented smoothly. By communicating the reasons for change and providing support, leaders help teams adapt and thrive in evolving healthcare environments. Professional standards are the foundation of quality care, and clinical leaders uphold them at all times. They model appropriate behavior, enforce policies, and address lapses promptly. By setting clear expectations, leaders ensure that teams maintain high standards and deliver safe, ethical care to every patient. Lifelong learning is essential in healthcare, and clinical leaders encourage it among their teams. They support ongoing education, provide access to resources, and foster a culture of curiosity. By prioritizing learning, leaders help staff stay current and adapt to new challenges in patient care. Patient-centered care is a core value for clinical leaders. They ensure that care is tailored to individual needs, preferences, and values. By involving patients in decision-making and respecting their choices, leaders create a more compassionate and effective healthcare experience. Evaluating outcomes is a key part of clinical leadership. Leaders review patient results, analyze trends, and use findings to improve care. By focusing on outcomes, leaders ensure that teams are meeting goals and continuously enhancing the quality of care provided. Celebrating successes is important for team morale, and clinical leaders make it a priority. They recognize achievements, share positive feedback, and celebrate milestones. By acknowledging hard work, leaders motivate teams to continue striving for excellence and foster a sense of pride in their work. Summary: clinical leaders are the driving force behind high-quality healthcare. Their influence extends from patient care to team development, innovation, and organizational success. By embodying the values of leadership, compassion, and excellence, clinical leaders inspire those around them and shape the future of healthcare. As we've seen, their role is multifaceted and essential for delivering safe, effective, and patient-centered care. Thank you for joining us on this journey through the world of clinical leadership.